One of the most controversial issues facing CEOs today, healthcare coverage. Recently, BizWise TV caught up with healthcare economist Len Nichols and Pennsylvania business advocate Cliff Shannon to discuss the impact of healthcare costs and steps you can take to lessen the blow. Len and Cliff, welcome to BizWise. Len, we'll start with you. Can you give us an idea of the impact this healthcare crisis is having on small to mid-sized businesses?
Well, in fact, it's hitting small businesses more seriously than any other single sector. Healthcare premiums are growing for them 10 to 20% a year. Some large businesses are able to hold cost growth down to 6 or 8%, but small businesses have had a much harder time doing that. So for them, each year, they're looking at a 20% increase in what has become their largest non-wage cost of business. Well, there's no question that it's constraining the formation of small business. It's driving people back to large businesses. It's requiring them to have their spouses work for a large business to have access to health insurance.
Len, in your writings, you've really promoted this idea of mandatory, affordable health care. In fact, the ultimate solution where you're concerned is to have the employer just step out of the picture altogether and set up a kind of shared responsibility platform. Why should the employer get out of the picture?
There's no way for us to continue to rely on employer financing and compete in a 21st century economy unless we find a way to transition out. Now, a key word is transition. I'm not for just pulling the employer plug and sending workers out into the individual market on their own. We have to work out a system whereby we hold on to the advantages of the employer system, that is, administrative economies of scale, risk pooling, and the shared responsibility comes in. We're going to have to subsidize our low-income population as a nation, and I would consider that the true shared responsibility across the country.
Cliff, you suggested that these solutions really only just nibble away at the foundation of the problem. What's really going on that's not being addressed by new payment scenarios?
Key question then seems to me, the overarching question, not how do we finance all of the health care that we're consuming, but rather how can we do something to rationalize the health care that we consume, make it be of very high value.
Cliff, in fact, some of your research has suggested that the quality of care in this country really isn't top flight.
Compared to other developed nations, some calculations have it that on a per capita adjusted basis, Americans spend 1/3 more than the next highest expenditure developed nation. What do we get for that? Overall health indicators that are far below average among developing nations. We absolutely do not get the value for healthcare expenditures that we should.
You know, it's funny, a lot of what we're talking about is just making healthcare like every other business on the planet. What's astounding is that healthcare has avoided the kind of scrutiny and transparency that others have been required to do, because we've been hiding behind this mystique of the great Marcus Welby behind the green curtain or whatever. And fundamentally, we finally said enough is enough. We're spending 16% of GDP. We're spending 20% of median family income on a family policy today, and that is unsustainable.
I'd like to say to my members something like this. Wouldn't it be great if your business model was that whatever you produced, good or service, your customer would pay whatever you told them to pay after the service or product was delivered, and no matter how poorly the product or service was delivered, the customer would pay full price plus the cost to replace the defective item. Wouldn't that be a great business model for all of us to be able to rely on?
And 15% more next year.
Right. But the fact of the matter is that it's almost impossible for an individual consumer to find out what anything costs. We're going to be pressing for legislation that would require all healthcare providers, all physicians and hospitals and so on, to post publicly their pricing for the 25 most commonly prescribed, most commonly performed outpatient and diagnostic procedures.
Well, Cliff, I was really interested in your perspective on local power. Is there a potential synergy then between the small business and regional entities in negotiating better healthcare pricing?
Employers, small, large, and medium-sized, ought to be fully engaged in trying to get the best performance out of the healthcare system as possible. One of the ways you can do so locally is to set up something we have in Pittsburgh, the Pittsburgh Regional Healthcare Initiative. They're all about trying to improve the quality of care that's delivered, and the stakeholders are business, foundation, civic leaders, and the healthcare industry, including the insurers. Small employers have a very tangible stake in employee health and wellness, and they need to take whatever steps they can through group purchasing or through some community health initiative, because healthier employees are more productive. Their health insurance costs less. They have fewer disability claims, fewer workers' compensation claims.
Right.
Large employers have the human resources departments and resources to conduct these programs. One of the reasons why large employers have relatively lower health care costs. Small employers need to band together to work on those things to make common cause.
Excellent. Okay, Lynn, give me your top 3 recommendations that every business owner can act on tomorrow to try to get a handle on this healthcare issue.
First, I would definitely stay in touch with your local small business association, look at organizations like NSBA, and try to make sure your voice is being reflected both locally and nationally. Second, I would join with whatever business coalitions you can find in your local area and or create one. And third, I would say begin thinking hard about the cost of doing nothing. Think about fundamentally what's going on now. Every year you're facing this 15% premium increase, whatever it is, and how hard that makes your business. And then weigh that against the cost of moving forward.
Cliff?
I would add this, if you will, prejudice on my part. I think we already spend as a nation enough money to provide quality health care, access to quality health care for every man, woman, and child. The question of how we allocate that money is the one that ought to preoccupy us. I think we have an opportunity through the kind of transformational change that we need to reduce national spending as a fraction of GDP and to recover some competitive ground that we've lost in recent years.
Good, gentlemen. We'll leave it there. Thanks for joining us.